Today I'm going to tell you about what is negative history and why do we take it. Now, whenever a patient comes to you with a particular symptom, then the purpose of asking questions is to reach to a particular diagnosis. Okay, so a negative history is actually, by negative history we rule out certain conditions. Now it is a part of history of presenting complaints. It is written as a second paragraph or additional paragraph of history of presenting complaints. Whenever a patient comes with any particular problem, initially you ask all the general information. After that you take what are the presenting complaints or chief complaints with which the patient has arrived, and after that we take history of presenting complaints, in which we elaborate each and every complaint. Now negative history is the second paragraph of this subhead, is this heading. The purpose of negative history is basically three things. First is you have to rule out different systems which are not involved. Second is that you have to rule out certain diseases of that particular system which you are suspecting is involved, but it does not have those diseases. So, and the third is that you have to rule out the complications of the most probable diagnosis that you are suspecting. Now, for example, suppose if there's a 6-year-old child who has come to you, a 6-year-old male child who has come to you with cough. Now here what we will do in the history of presenting complaint, we will elaborate the cough under different headings, like what is the onset of the cough, what is the duration, of course, what is the nature of the cough, it is productive or non-productive, or it is or if it's particular characteristic, like if it's barking or not. Then we ask for any aggravating factors, any relieving factors on diurnal variation, any progression over the period of time, and any associated complaints. If there is any associated complaint like fever, then we will have to elaborate the fever as well in the history of presenting complaint. Now, whatever symptom the patient is having, for example in this case cough, that could be because of multiple systems, not necessarily a respiratory problem. He could be having possibly he could be having a cardiovascular problem, or sometimes in children it can be because of a gastroesophageal reflex condition, or it can be also because of some problem like some drug intake. So how will you be sure that he is not suffering from any other thing? So for that we take the negative history. Now in respiratory problem, or suppose in respiratory problem, if your history is pointing towards the respiratory problem, in respiratory problem again the patient could have different diseases. He could be having upper respiratory tract infection, he could be having a lower respiratory tract infection, either bacterial or viral, or he could be having a tuberculosis infection, or he might be having a foreign body aspiration. So what is the possible scenario that we will ask questions regarding each and every, like we will ask if the patient is having any rhinitis, any eye congestion, ear pain, sore throat, to consider if he is having any upper respiratory infection or not. And then we will also be asking about if history is long, then you can be asking about if there is any blood in the sputum or not. In that case, you will have to write that thing in the negative history, that there is no history of blood in sputum, there is no history of rhinitis, as I already described. So you will have to, those things which are not present, you will have to put them in the negative history. Of course, you have to be mindful of the questions that you are asking. Like in history with acute illness, acute cough, you won't be thinking about tuberculosis in general, so you will not be asking about questions relevant to that, like weight loss and other things. But so that's why that what I am saying, that you also have to be mindful, but keeping the things that patient is telling, you have to think about multiple things that the patient could be having, and then in the negative history you have to rule out the conditions which are less likely, or which symptoms are not supportive of that particular condition. Now, as I already told you, that in cough, you have you can rule out cardiovascular system by asking if the child is also having edema or not, or if he had any cyanosis or not. Then you can rule out gastroesophageal reflex tendency by asking if it has any relationship to food or not, or if the coughing increases while lying down during night. And if that's an infant, you can have a history of arcing of the back as well. So these things you will be asking, and if they are not present in a case of chronic cough, in which it is a possibility that he could be having GERD, then you will have to place it in the negative history. Then after that, you have to, in any particular system, as I told, you will be, if there are multiple things that can lead to that particular symptom, so that also you will be excluding in the negative history. After that, suppose finally you came to conclusion that possibly the child could be having a bacterial pneumonia. So is it severe enough that the child is having respiratory distress? So you will be asking questions relevant to that. If the observant mother could tell you that the child had episodes of fast breathing or cyanosis, or he is getting, his sensorium is being affected, so things, his feeding is affected, he's being he's feeling fatigue, so all those conditions you will have to ask, and if they are not present, then you will have to place them in the negative history. So I hope with this your concept of negative history is better now, and thank you.